Okay, all distinguished academicians, I am basically a basic clinician. I am not very much in academy because in medical practice, you need someone who should be in academy and someone who should be a clinician. So I am basically a clinician. So, but my life struggle have gone through from very small town in UP to this place. In various places, in colliery I worked, in steel plant I worked. So here because they have written it as a Shishu Sanjeevan hospital, when I came to Salt Lake, always I had an idea that I should help the patient as far as possible. So in Salt Lake there was no hospital, and whenever a patient gets sick, I has to go to South Calcutta to admit those patients. So then I called my friends and I started my hospital for 15 years. Now, anyhow, at this age, for last 10-15 years, I am doing a lot of, voluntary service. I'm going to charitable institutes, 100 kilometers away from here. So what I observed, that I am thinking, and then I had a talk with Saurabh. We came across, because whenever you think something positive, positive people come around you. So I saw the diseases which I face over there and disease which I face over here in my chamber in Salt Lake. So what's the difference? The patients here, out of 10 patients, 6 are suffering from breathing trouble. We are giving them, inhalers, and they are all suffering from respiratory diseases. But in my early years of my practice here, we had a lot of different patients. Now they are all restricted to this breathing trouble. The other thing which is very, disturbing is that the young kids, they are coming, the parents are coming, that they are not, concentrating on their work. That is a condition called as attention deficit hyperactive disorder, the autism, the delayed speech. In my medical graduation time, we used to read autism as a, very it can come in our papers, and I have to write on it. That's all. Every day we are having autism patients. So then I started thinking, what's the matter? So as far as respiratory disease is concerned, usually, I used to say also, that's a pollution, But in Bengali there is a term called Shuririn na mahashoy, jaha shohaibe thai shoy. So when our body can adjust everywhere where it is, whether it is in, Antarctica, it has to adjust. So when I'm living in Calcutta with this pollution, I should be able to, my immune system should be able to handle it. So it came to me, these are the guys, these are the kids who are not exposed to sand at all. They are, we are all enclosed in the capsule. We don't walk on sands. We have AC and, fan. Water are filtered and, chemical. The air, we don't go out at all. We are going out to schools. All modern schools are now AC. Most of the school doesn't have playground. If they have playground, they are not allowed to play because big students are playing. Once I inquire from all patients, 1 day in a week is their game period. See? So how they will come to the nature? So nature has taken its wrath on us. So, and I live in Salt Lake. Whoever are living in Salt Lake, when there was a COVID, the maids who used to come in our houses are in Dattabad. We all 5 suffered from COVID. The maid, before we were diagnosed, we were coming. No one suffered from COVID. No one. No case in Dattabad. All cases in Salt Lake. They are playing on the ground. They are dipping in the ponds. And they are under sun. So as Panchabhut, our body has all the 5 matters which are made of. We have taken the enmity with them. So then I started thinking, let me tell them, go to the grounds, let them play. Whenever it rains, ask them to get drenched in the rain. If you get it every day, you will start developing immunity to that. So, and it clicked to me because all the cases when get exaggeration, they are recurrent, they are coming again and again. So, sir, there was sports in school, so we went to zoo, there was, Vidhan Nagar Mela, we went to that means kids will not go there, they will go with a mask. So they are going, we are putting the mask, so they are not going facing the sands. So sand is taking the enmity. This is with the kids. Now you come to adolescents. The mobile technology, they are all in it. The thing which I told you was the autism, and this is all because they are with mobile. Father, mother busy in their IT job, and the caretaker is taking care. She's also moving, seeing this mobile, and they're also seeing mobile. So they are not exposed to this nature which is so important. So I thought that this Vatika might be of helpful. Now, when I asked the parents also, why don't you go to, I went to Central Park, and I saw a 13-month-old twin sitting on the ground playing with the grass. I said, very good. I asked the parents, why you're allowing them to sit here? Said, this is sensory stimulation. Coming in touch with the grass, with the dews, with the sand, they stimulate the brain to grow. I said, very good. But why you are not in bare feet? You should also open your shoes and be in touch with that. So, the problem is that my love for nature is from inside. Now, many people who say, Doctor, wo maidan to saaf nahi hai. This is my mother. I'm born in mother's lap. If my mother's sari is, not well, it's not very clean, will I say I will not sit in that lap? So you walk in that, have faith, no problem. Even after telling, many of them are not walking, that's a different issue. But first of all, all the nature which is helping, whether it's depression, whether it's anxiety, whether it's Alzheimer's, whether it is, Parkinsonism, basically we are away from nature. You will not get these conditions in poor families. No Parkinsonism, no Alzheimer's, no hypertension, no diabetes. They suffer from no cancer even. They suffer from that taking betel and this thing, they get tobacco, they get oral cancer. Otherwise, they don't get cancer. So, see, the way we are inviting the disease in us, we are suffering from that, and we are taking treatment. The other thing which I should tell you, as a doctor with such of experience, what I feel when a patient comes to me now, what we say, yes, what's your problem? Sir, this is this. Okay, take these medicines. You don't talk to them. You don't know their emotions. You don't see what's the family they are running. So, it's basically, I am Dr. Chakraborty, I am speaking on medical grounds, nature with. So, now what is the barrier? Why doctors are not talking to the patients, not taking their emotions, not seeing, just looking at a patient, their emotion, you can diagnose so many things. So, thing is again, father is sitting with a mobile, mother is complaining. So, this technological advance which has come up, probably it's putting a barrier between doctor and patient relation even. So, when I see a patient, I always say, see, you are my family member. Now you tell everything about your family, how you're leading, especially for kids. I feel pity because they are the future generation. And we are not giving time to them. So what will happen to them? And parents are worried. But they say we are helpless, we can't give time to them. We have to earn money. So anyhow, in that way, Biophilic Garden attracted me. And the one which I have created he has created and I have in short, let me tell you, the one in Adyapit which we have done, the purpose was, many of them we visit temple, we go to Mother Kali and we offer garland, Jawar Mala. It's put on the mother's, and then as soon as its value is over, they're throwing it. So it has only the value till you buy and put it in the mother's neck. So what the concept he developed that I liked is, you give a tub with a plant and let the place in the around the temple, so that it has a value, and after some time you can take it to the house. You can put a sticker of Mother Kali and it will be used there, instead of giving so much of garland, hibiscus, and they are throwing away. So that was our concept, to do that. And number two is, people put a stone in memory of father, mother, and like that. People are walking on that, no one watches. So this garden I have put in my father's memory. So people are taking more selfies in front of that garden. If you ever visit, you will see. So instead of that, you can put a small, they make with a bamboo surrounding with a plant, with your mother's name, your father's name. It will always remain there, and it's going to give beautification. And the shop owners who are keeping the garland of flowers, they will keep that tub, so it will be greenery around. So that will also be living, so they will earn from that. So that concept was very good. So we have started here. Now we are trying here in Jairambati. I go there also to see the patients. So they also agreed. So we are going to put a temple in the temple, that garden. That's all. Thank you. One suggestion from my side. As a doctor to all of you, listen to your body. Listen to your body. Your body will tell you when you are sick, we are not sick. Nowadays, many labs are coming with 900 rupees. You will get so many tests done, and go for it. Some level will up, some will be down, and you will search in Google, and you will get disturbed. You go to the doctor, and they will prescribe medicine. But if the sugar is a little high, are you having that symptoms? No. Why you go for getting it checked? It was, they came, so it was cheap, so you got it done. So listen to your body. Even a newborn can tell he is sick. We can judge it. A small story, let me tell you. I was coming in a flight in Delhi to Calcutta. A child was crying. Everyone was disturbed, and the mother saying, do an emergency landing, do an emergency landing. Unfortunately, I didn't have my stethoscope. So I said, okay, I being a pediatrician, will you allow me to examine? I said, okay. So I just saw the patient. I touched the feet of the patient. I said, the child is okay, he's crying because of the pain. Now you see, this child can tell you he is in agony because he has pain. So his brain is working. That's why he's able to express his discomfort. He's breathing out. In pranayama, we breathe in and breathe out long. So when you cry, he breathes out a long breath. So his lungs is working. Otherwise he cannot breathe out such a long. And his feet are warm. So his heart is working. So why are you worrying? It's only some mother came and said, I will give paracetamol. Before that, I asked her to breastfeed the baby. Now, see how the emotion carries in the baby. It's a 7-month-old. Mother is taking, baby is not taking the breast. So, now the story next is, after giving Tosin, again mother tried to pacify. No? Another mother who was 1.5 years old, whose son is 1.5 years old, he said, give me. She was peaceful, calm. She took the baby on the lap and started soothing child. Child slept. So mother's emotion is going to the baby, and baby is in discomfort because mother is all in trouble. The baby is in trouble. So this is how the emotion carries from doctor to the patient. So always I say a doctor should be smiling, should be touching the patient, should talk to the patient, and then start treatment. Medicine is last. First you tell what you are suffering from, why you are suffering from, how can you get treated without medicine, then you go for the medicine. So that's not happening nowadays. Okay, thank you.